Well, my friends, at the end of today's clinic, I do like to demonstrate a case of colic of 1 year duration is totally cured. The subject is this little girl, age about 10 years, who had been suffering from abdominal colic around the umbilicus for last 1 year, for which the parents consulted with numerous allopathic and homeopathic physicians, but all the treatment only gave time to time palliation and not permanent cure. এ কথা ঠিক? So, colic, pain around the umbilicus. কোন জায়গায় ব্যথা ছিল দেখাও? Pain around the umbilicus. So the child was suffering tremendously with great agonizing, colicky, griping, excruciating pain around the umbilicus now and then, for which all the treatments of other branches totally failed except palliation. Now this is the high time to me to prescribe homeopathic medicines to establish the cure homeopathically. I had prescribed only a single medicine, Plumbum metallicum 1 mg, 6 doses, followed by some PTRS. PTRS means please take rectified. So, অনেক ভালো আছে. The child is better. By one-time medicine, 1 year's duration's colic is totally stopped. The father is worried. Well, doctor, will the colic is further appear? I have assured no. When the cure is established, when the cure will be established by homeopathically, that means by the dynamic medicines with the constitutional mode of treatment, the colic will not reappear. আপনার চিন্তা করার কোনো কারণ নেই, এই যে মেয়ে সুস্থ হলো আর কখনো এই ব্যথা আসবে না। তোমার কি এর মধ্যে ব্যথা আর হয়েছে? হয়নি। তুমি স্যাটিসফাইড হয়েছ? এ ডাক্তার কি ভালো মনে হয়? ঠিক করে বলো জোরে জোরে। তাহলে তুমি ডাক্তারের জন্য কোনো খাবার এনেছ? পরে আনবে বলেছে। সো দিস ইজ অ্যানাদার সাকসেস অফ হোমিওপ্যাথি. The cure is the ideal cure, not the palliation or suppression, and the parents are satisfied. বলো, তোমার মেয়ে কতদিন ধরে ভুগছিল? বিভিন্ন জায়গায় দেখিয়েছিলে কিন্তু পার্মানেন্ট রিলিফ হচ্ছিল না।
এখন ঠিক আছে।
কবার ওষুধ দিয়েছি আমি? একবারের ওষুধে মেয়ে ভালো আছে। আজকে সেকেন্ড টাইম। তুমি স্যাটিসফাইড? আপনার মেয়ে, আপনি স্যাটিসফাইড? So, colic is cured of this girl, innocent 10 years girl, totally cured by one-time medicine, only the potentized Plumbum metallicum, the medicine has prepared from lead. Well, my friends, colic means colicky pain. A colicky pain occurs when the muscular wall of a hollow tube is attempting to force certain contents of the tube out of it. The pain appears suddenly and goes suddenly as if it came. The pain always griping in nature and may not be very excruciating, but often associated with the vomiting and sweating. There are different types of colic. Some of the important colics are biliary colic. That means the colic, the pain within the gallbladder. Uretary colic, pain within the ureter. Renal colic, pain within the kidney. Intestinal colic, pain within the duodenum or jejunum or ileum, appendicular colic, pain within the appendix, ovarian colic, pain within the ovary, uterine colic, pain within the uterus, etc. The biliary colic or gallstone colic. There is severe colicky pain over the right hypochondrium radiating to the inferior angle of the scapula. I mean the right scapula and right shoulder. It is caused due to spasm of the gallbladder to the force the stone down to the cystic duct. The pain is intermittent in nature. If the stone lies within the common bile duct, there will be no severe colicky pain because the bile duct has very little smooth muscle in its wall, so no severe colicky pain. When the stone lies within the gallbladder, there is severe pain, but when the pain within the bile duct, the pain is less severe. There may be renal colic, that means pain due to renal stone or something wrong in the kidney. It is usually felt in the renal angle. That is the back at the angle between the outer border of the erector spine muscle and the outer border of the 12th rib, which is known as the renal angle and which is related to the anatomy students. The pain may be severe and contrast, but not cramping. Not cramping, griping like gallbladder pain or appendicular pain or intestinal pain or uterine colic. Rather, the pain is often dull. The pain often spread along the subcostal area towards the umbilicus. The patient shows the site of pain by putting his hand west with his finger spreading backwards to cover the renal angle with the directing the thumb towards pointing to the umbilicus. There may be intestinal colic. Intestinal colic. Your colic was intestinal colic. পেটের নাড়িভুঁড়ি যেখানে আছে সেখানেই ব্যথা কোথায় বললাম শাবাশ So this is called the intestinal colic. This is the path in the small intestine due to an intestinal obstruction or from toxic enteritis. Intestinal obstruction may be due to the intussusception or from a roundworm obstruction, but toxic enteritis occur due to improper food or diet and generally with some diarrhea-like stool. Intestinal colic also may be due to lead poisoning. Who deals with the lead? The lead poisoning symptoms are severe constipation and distinct blue line of the gums. Children nowadays used to take some dry foods, packet foods, which may contain lead, zinc, cobalt, many chemicals. So there may be chance of intestinal colic, and I do believe the child was suffering from lead poisoning colic like that. So different types of colic. There may be uretary colic. It is due to the ureteric obstruction due to a calculi. The patient seized with sudden pain starting in the loin and radiating down to the groin, to the testes in case of males, or inner side of the thigh in case of females. Here pain is referred by genitofemoral nerve. The testes of the affected part may be drawn up and it is often accompanied by vomiting, profuse sweating and frequency of urination, my friends. Another important colic is appendicular colic. Many children are suffering from appendicular colic. Severe appendicular colic arises when the appendix becomes obstructed. There is severe colicky pain in the right iliac fossa with vomiting and rise of temperature. It is a very serious condition and demand immediate surgical interference due to greater possibility of gangrene and perforation of the appendix when the acute appendicitis is obstructed. But non-obstructed appendicitis cases are easily curable and manageable by conservative methods of treatment. So, these are the, in short, I have described few of the symptoms or symptomatology of the colic, and the child was suffering from intestinal colic, and the symptoms are severe constipation, relieved by rubbing, and the center was umbilicus. So by these three symptoms, I had prescribed plumbum on him, and the child is totally cured. So it is another success in homeopathy, my friends. But the cure is only possible. The success will only comes by the proper method of case-taking analysis and evaluation of symptoms, by proper interpretation of symptoms with analogy, and the proper case-taking considering the present complaints with its 5 legs: causation, location, sensation, modalities, concomitants, and with the important past history, family history, personal history, and the homeopathic general symptoms. Do you understand? বুঝেছ? সব বুঝেছ? সাবাস, সব বুঝেছে বাচ্চাটা, তাহলে আমি এখন রেখে দিলাম। So it is another success in homeopathy, my friends.